Now, in relation to the posture question, like second question after break, are you suggesting that someone's posture can be affected by their shoulder, but also just kind of their leg stance? Because I have a client who's seeing me specifically for posture correction as well as just upper body strength, and she has more of a curvature in her upper back, kind of a humpback style curvature, and she has pain in her right shoulder, but also if you look at her back, there's a difference between the left and the right side.
And what do you think's wrong with her? She has a what? Guaranteed she has a frontal plane. I like it. The big medical term is scoliosis, a frontal plane imbalance. Her spine's curved, guaranteed. So that curve of the spine causes those counter rotations, and this is for the lower extremity class, which is even more complicated than this. But that causes, those curves are what cause you to counter rotate. Why do you do all this rotation? Because your eyes want to be what when they get to when it gets to here? Do you want to walk around like this all the time? No, your eyes have to come back and try to be level because of your vestibular system, for your balance and your sight. So all these curves are compensatory. So whenever you guys see one shoulder blade sticking back to you more than the other, one's up higher than the other, look at the spine first. And in her case, even my older age, my kids are constantly telling me, hey Dad, you're starting to get a little, and I spend too much time reading in front of the computer now, so I'm constantly trying to stand up straight. But even this kyphosis is a spine problem. The thoracic spine is becoming too kyphotic, too forward. Is it a shoulder blade problem? It's a spine problem. Now what's it going to do though? It's going to limit the amount of elevation I can have in the shoulder, because when I'm in this position, my thoracic spine can't extend. And spinal extension in the thoracic spine is the last component of spinal elevation. So it's going to limit your overall elevation in that kyphotic posture. So if you have an older client that's kyphotic, are you going to force overhead motion? No, but does it matter because David just taught you? Do you even need to worry about that? We're going to get into that this afternoon after lunch a little bit, but we're going to stop forcing that elevation motion because it's just not really that necessary. In the shoulder, it's the most problematic on the rotator cuff.